The second movement of the MamasteFit Birth Prep Circuit is the back expansion exercise. And so during pregnancy, a lot of us favor this very extended and arched position. It's a common postural tendency. We're trying to counter this increase in rate forward and up from our belly growing. And so we tend to find this more extended position. This is fine, except for finding this more extended position makes it harder to find more of that posterior pelvic tilt, which is important to open the top half of the pelvis from front to back by moving the sacral promontory backwards. And then a posterior pelvic tilt also makes internal rotation easier to achieve, which helps us open the lower half of the pelvis. So because these movement patterns tend to be harder to find during pregnancy, we emphasize them in our birth prep circuit because this is really going to help you open your pelvis for labor. And so the back expansion exercise is the first one that we're going to do to help us find this rounded position. You're going to hold on to a sturdy structure such as your door frame, and you're going to sit back into your heels as you find length in the arms. And now all of the tension is really in the arms here. We're going to push the chest and belly away from the arms to find this rounded position. And then we're going to inhale to breathe and really try to feel those ribs expand and stretch. And then exhale either to release or exhale to pull the belly towards spine as you bring the rib cage and pelvis closer together. And this is going to result in more of a rounding in your back. So big inhale to feel these ribs expand. Exhale to release or pull ribs and pelvis closer together to find more of a rounding. And you'll breathe here for 5 to 10. And now in all of the movements in this circuit, we're not trying to find our deepest expression. We don't want you to cramp in these positions, but you should feel this big release in the backside of your body, which is then going to translate through the rest of the circuit to make it easier to release the lats, the hip flexors, and to find more internal rotation as we release the posterior pelvic floor.